Macular degeneration and what you need to know. As our eye ages, it'll go through changes, some normal and some more serious. A condition that affects millions of people is age-related macular degeneration, or AMD, and it's a leading cause of blindness worldwide. AMD is a condition that affects the macula, which is the central part of the retina that gives us our sharp, detailed vision. So when you're reading a book, watching TV, or just trying to recognize someone's face, you are using the macula. And when this part of the retina degenerates, you will have central blurred or distorted vision. Now there's two types of AMD, dry and wet. Dry is the more common version, and when we look into the eye, we'll see thinning or atrophy to the macula, pigmentary changes, or tiny little deposits called drusen. Now this one typically progresses very slowly over time. The other version is wet AMD, and this is due to abnormal blood vessel formation that will leak fluid or blood and cause a lot of changes to the central retina. This version can progress rapidly and cause significant loss of vision, especially if left untreated. Now, if you're diagnosed with dry AMD or maybe have a family history of AMD, your doctor will likely recommend using what's called an Amsler Grid. And that's a little grid that you can test your vision at home. And you want to do this one eye at a time. You want to look through your reading glasses or your bifocal. You want to hold the card about 12 inches away. Cover up an eye. You want to look at the center white dot, make certain that you can see all four corners, and ask yourself a few simple questions. Are any lines wavy or distorted, or any boxes missing? Now, if you truly have AMD, you may notice some distortion on this grid. Use that as your baseline, call that normal. But if you notice any changes above and beyond that, that could be indicative of wet AMD. You really need to talk to your doctor as quickly as possible. The other thing that we'll recommend is taking vitamins. We'll recommend something that follows the AREDS2 formulation, which stands for the Age-Related Eye Disease Study Part 2. These vitamins have been shown to reduce the risk of vision loss associated with AMD. Also, having a good healthy diet. Dark green leafy vegetables like kale and spinach leaves are very beneficial for the back of the eye. And if you're a smoker, stop smoking. This is one of the biggest risk factors for AMD. Now, if you should be diagnosed with wet AMD, we will recommend doing an intravitreal injection, and that is an injection of a medication in the back of the eye. It sounds intimidating, but it's completely painless and very quick. The medication that's injected is an anti-VEGF, and this stands for anti-vascular endothelial growth factor. And what that does is it gets these abnormal blood vessels to regress back. The issue is the medication only lasts so long in the eye, so it's very normal for a patient to have multiple injections. Some patients will have dozens over the course of years to keep their retina maintained. So if you have a family history of macular degeneration or have been diagnosed with macular degeneration, it's crucial that you keep up with your regular eye exams. Your doctor really needs to look at the back of the eye. We also incorporate a test called the OCT, which scans your retina. This test helps us, number one, diagnose AMD. It also helps us differentiate between dry and wet. It also gives us a baseline of what your retina looks like, so we can track the progression of the disease over time. If you have any questions, leave us a comment below.